Morning, everyone. So the topic for today is rust and rust seed. So I'll be discussing under the following contents: introduction, definition, historical view of rust, classification of rust, functions of rust, criteria for preparation of rust. Rest of the contents will be discussed in another session. So, rust is a rigid extension of fixed or removable partial denture, which prevents movement towards the tissue or the mucosa and transmit forces directly along the long axis of the tooth. Rust was introduced in the year 1899 by Bournville. So rust, by definition, it's a rigid extension of removable partial denture that contacts the occlusal, incisal, cingulum or lingual surface of tooth or restoration, the surface of which is commonly prepared to receive it. So a rust can be prepared either on the tooth or on a restoration. Rust seed, it's a prepared recess in a tooth or restoration developed to receive the occlusal, incisal, cingulum or the lingual rust. So rust seed, it's a prepared surface of a tooth or a restoration. It helps to receive the rust. So as we move on to the history, it was introduced as rust was introduced and recommended by Bournville in the year 1899. The use of rust on removable partial denture, which have been introduced by Bournville. So Henderson and other scientists along with him have stated that the principal function of rust is to transfer vertical occlusal stresses to the abutment teeth and to prevent movement of the removable partial denture in a cervical direction. McGregor and Stewart stated that the rust maintain clasp in the correct position, prevent foot impaction, and prevent the denture from sinking into or causing over displacement of the soft tissue. It also helps to prevent the impingement by the RPD to the soft tissue. Okay. Next is Stretchover stated that the rust must be positive and should not allow prosthesis to slide off the tooth. They must provide a positive connection between prosthesis and tooth. Next, we'll be discussing the classification of rust. Rust, it is primarily classified. According to Stewart, it is classified into two types, that is primary rust and secondary rust. Secondary rust, it is also known as auxiliary rust. According to its position, it is classified into anterior rust and posterior rust. Anterior rust usually can see in the anterior part of the oral cavity, and posterior rust, it will be on the posterior position. So it can also be classified into extracoronal and intracoronal rust. Example of intracoronal rust is precision and semi-precision attachment. Extracoronal rust are the normal rust which we prepared on the tooth surface, which is in the extracoronal position. So next is the functions of the rust. Main functions of rust, that is the primarily it prevents the vertical movements and transmit applied forces to the supporting teeth. These are the primary functions of a primary rust. Next, we have auxiliary or secondary rust. It used as an indirect retainers in extension-based RPD. That is mainly class 1, class 2, and long span class 4 cases. It prevents extension bases from lifting away from underlying ridge. Next, we have the main, what are the functions of rust? It helps in a vertical support. It acts as a vertical support, or it prevents the impingement of the RPD on the mucosa or the soft tissue impingement. It prevents. So it acts as a vertical support. It prevents impingement of the soft tissues. Third one is deflection of food by impinging the gap between the two teeth. It almost like closes the gap between two teeth and prevents the food lodgement between those spaces. Next, we have it directs and distributes occlusal loads. Fourth one, it maintains and Maintains the retentive clasp in proper position. The positioning of the clasp in a proper way, or the rotation or tilting movements will be prevented by the press. Next, we have it establishes a more acceptable occlusion plane. It also serves as an indirect retainer by preventing rotation of a partial denture, class 1 or class 2 RPD cases. Next, we have criteria for preparation of press seat. For the preparation, we need a high-speed handpiece with a coolant, and also we can use a medium round burr. A light pressure is usually applied while preparing the rest seat, and good visibility should be ensured. Preparation entirely, it is into the enamel. It should not be extending to the dentine, and anesthesia should be avoided so that we can know if it is going deep into the enamel or to the pulp. So always avoid anesthesia while preparing a press seat. Next, we have basic consideration for rest and rest seat. First, we have the rest seat. It provides sufficient space for the rest. It have a positive seat patiolingually and mesiodistally. So, rest seat, it's an actually, as the name suggests, it's a seat which accepts the position of the rest. Okay, it has a wide triangular space if it is an occlusal rest. Depending on the position, that is cingulum or incisal rest, you'll be having a different position and shape. Direct vertically applied forces along the long axis of the tooth. So, rest seat usually directs the vertically applied forces along the long axis of the tooth, so that impingement or the soft tissue and other hard tissue damage will be avoided by the use of rest. So, the rest seat, next we have the rest seat. It should have a smooth rounded shape with sloping walls. The wall should be rounded and it should be smoothened. Otherwise, it may have a chance it will fracture the wall or the edge of the tooth. So always smooth and round the edge of the walls of a rest seat. Be in caries resistant enamel. Always remember, when we prepare a rest seat, the tooth should not be having any caries, or it should not be in a fractured or fractured restoration. The restoration should be intact, or the tooth also should be intact. Otherwise, it may damage the prepared rest, and also it may chances are that the rest seat may fracture on heavy occlusion load. Last one is be easily cleansed. Rest seat should be should be able to clean it easily. So next we have consideration for rest. Rest usually is a rigid extension. There's the definition suggests it's a rigid extension. So rest should be rigid. Contacts the deepest portion of the rest preparation. Positive seat area should be there. It forms an angle of less than 90 degree with its minor connector. Next, rest, it should fill the rest preparation. That is the seat area. It should be completely filling without any gap formation. Also completing the contours of the tooth. It should be capable of rotation within the rest preparation for tooth tissue supported RPDs. A slight amount of movement should be possible in the rest seat preparation. So next we have three major forms of rest. That is, it's classified into, according to position, it is classified into occlusal rest, lingual or cingulum rest, and incisal rest. Occlusal rest usually prepared in the posterior tooth, mainly in the molars and premolars. Cingulum rest or the lingual rest, it is prepared mainly in the canine tooth, and incisal rest in the anterior, or even in the canines, we can prepare the incisal rest. So we move on to the occlusal rest. It's a by definition, it's a rigid extension of a removable partial denture that contacts the occlusal surface of a tooth or restoration, the occlusal surface of which is commonly prepared to receive the rest. Next, we have forms of occlusal rest and rest seat. Occlusal rest, first one is the outline form of an occlusal rest seat should be a rounded triangular shape with the apex towards the center of the occlusal surface. So apex of the triangle should be towards the center of the tooth, and base of the triangle will be at the margin of the tooth. The base should be at the margin of the tooth, and the width of the base should be 1/3 of the total labiolingual measurement of the tooth, or the buccolingual measurement of the tooth. It should be 1/3 the buccolingual measurement of the tooth. Next, we have the marginal root must be lowered and rounded. The marginal root should be always rounded. We are not supposed to keep it sharp. Then there should be a 1 to 1.5 mm of clearance should be given. The floor of the occlusal rust seat should be apical to the marginal ridge. Next point is the floor of the rust seat should be inclined towards the center of the tooth, so that the angle formed by the rust and the minor connector should be less than 90 degree. So the angle formed between the rust and the minor connector should always be kept less than 90